Thank you, Mr. Speaker. Our PC Engage document promotes strengthening access to primary care networks to provide proactive health care. Our previous government initiated the Rural Physician Action Plan over 20 years ago, and it's been extremely successful. To the Health Minister, considering the uncertainty that your review is provoking and the fact that you've finally confirmed RPAC will continue but in a different form, can you please provide Albertans with details about your government's change in direction?
Minister of Health.
Thank you very much, Mr. Speaker, and to the member for the opportunity to talk about how important it is, obviously, to make sure that no matter where you live, you have access to the right health professionals, which, of course, includes a physician in many circumstances. Immediately, when rumours were speculating about the future of RPAP, I put them to rest. I made clear that RPAP would continue. The responsible thing, though, I'd say for any government to do, and I was shocked that it hadn't happened previously, is at the end of a funding cycle to review that funding that was allocated and make sure it's meeting the objectives of which it was intended. I'm proud to do that as a governor on behalf of the citizens of Alberta, Mr. Speaker.
First supplemental.
Well, Mr. Speaker, I'm not sure if the honourable minister is aware that our House leader a full year ago made insightful recommendations for enhancing RPAP. And given that the NDP's vague musings now about RPAP have shaken the stability of many rural communities, and the review recognized that access to medical care increases quality of life while stabilizing the economic base for rural communities, it's not rocket science, Mr. Speaker. Can the Health Minister please tell us which of the Rural Health Service Review's recommendations are you considering implementing or dropping so these fine people can plan?
Honourable Minister.
Thank you very much, Mr. Speaker. To be very clear, RPAP does some very great work, and there is no question of it being eliminated, Mr. Speaker. But it's simply good governance to review a program when it approaches the end of its current funding cycle. So we've extended the funding in certainty through to the fall, and during the next few months we're taking the time to liaise with communities and make sure that we're achieving the right outcomes for rural Albertans. Unfortunately, over the last several years, the percentage of physicians practicing outside of Edmonton and Calgary has actually declined. So I want to make sure that we can find a way to address the needs of everyone throughout Alberta, and it might not just be physicians. There might be other health practitioners, like nurse practitioners, that we need to be attracting to.
Thank you, Honourable Minister. Second supplemental.
In my previous role in wellness, I learned this very well, but I wonder if the minister is aware of this. Given that the Rural Health Services Review actually consulted with Albertans across the province already, and it recommended expanding the mandate of RPAP to include other healthcare professionals, nurse practitioners, midwives and nurses, and given that, as Engage attests, fostering a healthy society reduces the strain on our healthcare system, thereby reducing costs. Exactly when will the Health Minister provide details on NDP changes to this already successful program, and will you be doing this solely in voice mode?
Thank you, Honourable Minister.
Thank you for the question that was delivered in voice mode. I'm happy to respond in voice mode or via email, whatever way you'd like it to be responded. Certainly, the $10 million that is committed currently through RPAP is an important investment, but it's actually only about 10% of what we do in terms of investing in rural-specific education, training, recruitment, and tension programs for rural communities. So certainly it's an important piece, but it's not going to be the standalone be-all, end-all. We need to make sure that we continue to consult it through a variety of modes with our partners like the AAMDC, which I was very proud to attend just a few weeks ago, and continue to get feedback from them as we move forward, Mr. Speaker.